Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes or so discussing one of the strategies made available to agents that are working a market venue location, retail, and how this is utilized as a component in many successful marketing plans for agents in the annual election period and throughout the year in different circumstances. Today's presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. I do want to make you aware of the fact that many of the concepts or ideas, hints, tips, whatever you want to call it, that we cover today can be applicable to other saturation marketing techniques for a specific target area. So keep that in mind as we go forward. We do have a section in the software system for questions and for chat. We ask that you put your questions in the questions box. We do find that we cover most of them through the course of the presentation, but I want to make certain that we get you the information you need to get as much from the investment of your time in today's presentation. So let's start with a little bit of level set as to who Premier Marketing is. From the names of the folks that are on this presentation at present, I recognize a number of them and you may be familiar with us, and there are a few on there that may not be. So as that level set, I want to make certain you understand that we are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform with offices across the country. We're licensed in all 50 states. We act as an insurance wholesaler working through independent insurance agents such as yourself in arrangement through contracts at the highest possible commission levels with recruiting contracts available to those who qualify. And we do so through a full portfolio of products that are aimed at the Medicare population. So you have the base Medicare programs, the Medicare Advantage, Medicare Supplement, and standalone Part D prescription drug programs that are key components in working retail, particularly in a pharmacy setting. But we also offer life insurance and final expense products, pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, hearing, critical illness, cancer plans, hospital indemnity, accident, and telehealth programs. We speak to the full portfolio because this is an opportunity for you to leverage your contacts in a retail setting that may not be eligible for the base medical programs, and you want to make certain that you get value out of all of your discussions. But it's also an opportunity for us to cross-sell and differentiate ourselves from some of our competition. So when we look at the Medicare Advantage plans, you got a broad portfolio there with the national leaders and many of the strong regionals in your market. Key component for a number of reasons. One, if you're working the Walmart situation, they require you to have multiple contracts. But also, many of these carriers have their own retail programs as well. And we want to make certain that you're made aware of opportunities across the board that can help you in many different circumstances, particularly at this point in time in the year. Can you imagine we're halfway through 2022? Well, that same philosophy that we have with the Medicare Advantage programs also applies to the standalone prescription drug plans, those PDPs, those Part D programs that in most instances are part of the Medicare Advantage contract offered by the carrier in question. A couple of exceptions there. The Mutual of Omaha contract is for Part D product only. It's separate from some of their other offerings and separate from their MedSup, an important point to make. And the Clever RX program is actually a discount plan and not a Part D prescription drug program. When we look at the Medicare supplement plans, this is a key component that may not be marketed as heavily on site at a pharmacy. But when you have someone asking about standalone Part D programs, it's generally because one, they're self-insuring for the shortfall on the medical coverage with original Medicare, or two, they have a Medicare supplement plan and need coverage for the prescription drugs. So we want to make certain that we have a broad offering here and systems to make you successful in this space as well. So we're looking at a full offering of programs for the Medicare population. That also includes offering ancillary coverages in each of these key categories. You see the national leaders that are there for you. Outside of the fact that it drives revenue to you and your agency, most importantly, it covers the additional perceived needs that we have in these different areas that may not be covered or covered fully enough for your prospects and clients, but it's also another way for us to market. In the retail setting, keep in mind when you enter into discussions with folks in that situation, you're obtaining a scope of appointment. In most cases, you're using a generic scope of appointment, and one of the items that is listed on there brings in and announces the fact that you can discuss ancillary programs in that same appointment as the base medical coverages. So if you have someone who is looking for dental coverage, and even though some of it may be available through their MA plan, through their Medicare Advantage program, it may not be enough, or someone's had a family history, or in the past, someone else that they're close to that's fought cancer or has been in a hospital, and they recognize the need for additional coverages. We want to make certain that whatever the hot button is for your prospect or client, we're there with a solution and we can help them in that circumstance. We speak to the Medicare opportunity and the huge markets that's there. You come on a program like this, everyone speaks of the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. Well, it's near exponential growth based on age, but keep in mind there's a growing percentage of people that are qualified for Medicare but not accessing full benefits. These are folks that we still need to address the needs of and make certain that that full portfolio gives us the opportunity to do so. So it's reducing that total number of folks that are on Medicare, and that we can speak to about some of the base products, but that is actually more than made up for by the folks that are on Medicare that qualify because of Medicare disability, medical disability, pardon me, Freudian slip there. And this is actually a population within the Medicare community that's been pretty hard to identify and very difficult to actually directly address through some of the traditional means of advertisement. Outside of, I haven't seen any of the retired quarterbacks from the NFL come on TV and speak to this population directly. But it's something that we can then make certain that, hey, they're coming into a pharmacy to pick up their medications. We got a pretty good shot at helping these people. And part of that is the communication we have with the staff at the pharmacy and the relationship we have there. We'll talk about how to grow that in just a wee bit. We want to make certain that we are able to cover all of the choices that an individual makes when they come into Medicare or work the relationship they have with that healthcare delivery system. Because let's face it, they could decline the optional Part B should they choose to do so. Some for good reasons. They may have coverage elsewhere. Some because they're looking at the Part B premium and say, fungu to that. Well, these folks thankfully are in a small minority of the population. Some will actually have Part A and Part B and self-insure for the shortfall and then pick up that Part D program to help with the prescription cost. These are a subset of the folks that we will see in a retail or market venue location. Many of them, however, will be taken care of what Medicare doesn't cover because of the standardized, modernized Medicare supplement plan. They're going to need help with their medications as well. And then, of course, there are the folks that are accessing their prescription benefit through the bundled Medicare Advantage prescription drug programs. We can obviously help in that area as well, and do so through an analysis of their current medication use, combined with the other factors that they have in their own personal situation as to help them define what may well be their best choice for coverage for the coming year. What we've seen is as people come into Medicare, it's been a pretty even split historically over the last few years. According to some detail that we have from Deft Research, we've seen some changes over the last couple, 2-3 years affected by, well, gee, what else? But you're seeing a population come into the Medicare arena that are more comfortable with doing some things electronically. There's a lot of media exposure for Medicare Advantage products. So we're seeing a bit of a twist as to who's enrolling where and why. You do see a category here of 17% of the population that are designated as original Medicare only. Keep in mind, this still can be a market for us for a number of different reasons. That's including the Medicare and Medicaid population. So that same sort of analysis is there for these folks for whatever coverages that they may have been auto enrolled in or an entire package through a dual special needs plan. It also includes the folks that have coverage through retirement programs or union coverage. And then, of course, you do have the folks that are accessing the VA and those that are self-insuring. In each of those circumstances, much as what we've discussed as to a circumstance as to the choice slide, we want to be able to have solutions for these folks as they walk through a location that we are manning for specific time periods throughout the year. So that opportunity is very large. We want to make certain then that we also help define the information that folks are receiving. We've all heard the term paralysis by analysis. I've been in homes where we're discussing their options and they're pulling out a stack 4 inches tall of direct mail that's been addressed to them with their different choices that are there. In many cases, some of this communication is using acronyms, and it confuses some people, not only with some of the solicitation they're receiving, but also it may be part of their ANOC letter, their annual notification of coverage letter. That confuses them. We want to be able to help them translate the information. This is an acronym guide off the CMS website that it isn't that old of a slide. And look, there are 4,420 pages of acronyms. Yowza. We also want to make certain that we use this as a reminder to limit our use of acronyms in our discussion. And as we do so, we define them repeatedly through the course of our presentation. So a lot of what you will think traditionally deals with retail settings, market venue opportunities, does occur during the annual election period. That time period is October to December 7th. That gives us an opportunity to market in these locations. However, this is also an opportunity in many circumstances that give us a year-round opportunity, even if it's an informal situation. Once we're removed from a kiosk or a booth or whatever it is in a location, maintaining that relationship with that store personnel and that location can make a huge difference as to our overall return of the investment of our dollars and times and effort that we're putting into this situation. Because keep in mind, there's a ton of special election periods, a SEP, that is available to the population. Majority of people on Medicare will qualify for one or another through the course of the year, it feels like. But it's then a determination of, is it the right situation for them? We'll illustrate how it can be moving forward, because we also have those special election periods brought about by different circumstances in different areas that also create that opportunity to change coverage. And that's important because that annual election period that we get all hyped up about and we have the opportunity to work retail, well, there's a whole bunch of folks out there that aren't comparing their plans year over year. This Kaiser Family Foundation piece with some of the latest data that they have available shows us that over 70% of the population, more or less, don't compare their plans year over year. And for those of us that have been active in the Medicare population, we realize that, man, there are changes that can really make a difference. and can really not only affect your coverage, but the cost of the coverage, regardless as to the choice of your base medical coverage. And there are certain subgroups that are particularly affected by this, where they're not comparing the coverages for one reason or another and may have a problem understanding it. There may be people that are being set in their ways, follow that same cattle path through the pasture, and aren't really sure where they can get the information they need to make a choice. And this applies even to the standalone Part D programs. It's amazing how many people will get into a plan and they ride that pony for as long as it lasts. And that includes people that are accessing their medications through the Medicare Advantage programs. Even larger percentage of folks aren't looking at that component. And we know how formularies can change, how levels within formularies can change, and how that can affect cost. We've seen some recent information as to the changes in the maximum out of pocket, that going up once again, and that particularly affects folks that are in a PPO situation. So we want to make certain that we have the information available to them, because they're not using what the government's providing, the technology, even though they're becoming increasingly technically savvy, this population, they aren't using that. Many of them will get that Medicare New book that's sent to every Medicare recipient, either electronically or by the United States Postal System in October. Oh man, they aren't cracking that thing. And if they are, they're not reading it all the way through. They may not be aware of those changes because they're not accessing material that's out there to help them. So we want to make certain that in a retail setting, we're doing some things obviously there face to face, but some of the follow-up may be done virtually. We want to make certain our carriers and our marketing organizations have the support programs to help deliver that information to our prospects and clients. And we're doing so with the capability of moving back and forth between the types of presentations that are out there. So when we're in a retail setting, we're looking at a population that's become much more digitally savvy. They've been trained. We've all been trained over the last 3 years or so, from our doctors and our specialists that are doing virtual visits. Not as common now, but still a component within their delivery of care. Same thing applies to preliminary work for dental services or stay in a hospital. It's even a way that many organizations now are accessing celebration of faith with their church, their mosque, their synagogue, where those are being done virtually as well. So folks are much more aware of and appreciate the opportunity to receive the information virtually. And we want to make certain that we do that. And that gives us then the opportunity to look at a retail setting and go, wow, this is an opportunity to gain leads. I will enroll someone at the situation if I'm, or at the location if I'm doing it compliantly. But if there's a lot of people in there, I want to make certain that I capture as many prospects as possible as well. Set up the appointments thereafter, either live or virtually, to give us an opportunity to speak to not only the program in question about the coverage of their medications, but an overall review of their needs to give us an opportunity for additional sales as well. So as we look at concepts as to how we can make retail pay as part of our marketing programs, we need to make certain that we realize that there's no one silver bullet that's going to make us totally full of appointments. So we want to use retail as part of a concerted, comprehensive marketing plan that will be effective not only during AEP, but also now to drive business for us now, because a lot of our prep work, the time is now. But it also gives us an opportunity to continue that relationship, morph it perhaps as we need to, adapt it to a situation where we're not actually sitting in the store. How can we still leverage that experience and make it part of our marketing program year round? Because we've got to realize that As I mentioned before, as we pointed out, some of the Medicare Advantage carriers, there's a ton of them out there that have programs. This is not by any means a comprehensive list, and it is not a situation where with some of these carriers, we can speak to you with any certainty as to what they're offering. Many of them have filled slots that they have in their retail programs. However, the best source of information here is your local carrier agent manager, because they're the ones that are generally tasked with oversight for retail. They know the opportunities in your particular market, what has been made available, what is still available, and what support you can expect from that carrier with whom you are concertedly, consciously marketing their product in their location provided to you by them. In most cases, this is done gratis. Unlike the next program we discuss, you don't necessarily have to pay for a location. There are some exceptions to that, of course, but we want to make certain that you are getting the information about these programs straight from the horse's mouth. And that is that local management in your market. It not only gives you the opportunity to learn of the possibilities in this area, but it's also a way to enter into a discussion with an individual that may have other lead sources made available to them for you, and how you can participate in those marketing efforts as well. We are entering into the fourth round of the Walmart retail program selections. So many of the prime locations within that initiative have been purchased and are spoken for, but there are still some opportunities within Walmart's. Keep in mind, this is an organization that does charge for participation. It is, however, an investment many agents have found to be very worthwhile. It all depends on the attitude and the initiative that you can demonstrate here and with any of the carriers as well to augment foot traffic within a store. If you worked retail in the past, or any type of marketing situation here, or a community event, you look at someone to get their attention, you say hello, and oh, boom, all of a sudden you have rabies, they turn their head away, and they run down the cold cut aisle, whatever it happens to be. We want to make certain that we're demonstrating our value to our own goals and to our partners in this initiative. And then, of course, there's always the opportunity for you to set up your own grassroots campaign through a center of influence that you've identified within the community that may well not be a pharmacy. You use it as a hub, a base of operation for a market venue retail situation. So we want to make certain that you are leveraging the support from those insurance carriers that are part and parcel of those efforts. Your contracting upline, be it multiple levels or whatever it happens to be, for support for this initiative. And we want to make certain too that we're carefully choosing our targets and identifying what may well be the most successful location for you. And that, of course, depends upon you. And let's talk about that in a little further detail. Because outside of identifying that location as to where we're going to base our operations, we want to make certain that we're properly contracted and certified to deliver upon the product that our public is interested in. And that may entail additional contracting and certification. For some folks, they look at this as a additional onus placed upon them at this time of year. It's one of those situations where you got to look at it as it's a learning experience. How can we get something out of the time that we're passing a test, in a manner of speaking? Can really help down the line. Plus, you want to know what the heck you're talking about. We then want to take that information and assimilate it into our marketing and sales ability, because we want to know the product. We want to know the intricacies of network, different types of benefits that are there, social determinant of health benefits are a big thing right now. Some of those extras that people get in an MA plan, it's all part of that success strategy that you put together to make certain that the time that you're spending in a retail location pays off for you. So once we've identified our hub, be it a pharmacy or a different center of influence in the community, we want to make certain that we're looking for other centers of influence that can affect our success in that setting. And that includes where people go to live, worship, or seek care. Overly simplifying it because they got to eat too, and that's another avenue for us to pursue. We want to make certain that we're identifying these centers of influence that are in proximity to our chosen location, and we are driving traffic as well to us in our ad hoc office that we've established in our pharmacy or other base of operations. We then take that and integrate it into our overall marketing efforts. We're out there in the community, pressing the flesh, shaking hands, kissing babies, looking to get elected, all the while using that location as the reason for the visit. And you'll be surprised how that can be a differentiator for you as the success or not so much of a success in this initiative. So we planted our flag, we know our base of operation, we're then going to identify different churches, synagogues, mosques, senior centers, nutrition sites, where people live, where they seek care, other centers of influence in proximity to that location, and let them know what we're doing, plain and simple. We're going to go into the lovely internet and locate different churches through churchangel.com, a great website to find different Christian communities in the area around where you are working. It gives you the contact information and locations of these churches so you can visit either virtually, telephonically, or in person these different locations and let them know that you're available at this location, this date, this time, and how it's of service to them and their congregation. Same thing goes to the Jewish community and the synagogues that are in the area, and for folks that worship um, and access a place of worship through a mosque. Wherever we need to go to make certain that these real drivers, these influencers of the population in that area, well, they know of the services that we're offering and how it can be delivered in a totally non-threatening type of scenario. It also gives us an opportunity to visit with other locations that, particularly at this time where we have food insecurity in many cases, with the price of gasoline that's more than doubled, that makes it difficult for a person on a fixed budget to deal with those additional costs. They may need some help with food. So how do we locate food pantries? This can be a great site for evaluations in annual election period, but this is also an area that give us an opportunity to make certain that these folks realize we can help them year round. We can help them deal with their medication costs so they don't have to make that choice between, do I handle my prescription or do I buy a can of beans or whatever it happens to be. We want to make certain that we can help this population because, hey, in most cases, they may well qualify for that step, that special election period that we can help them with year round. Same thing goes into different nutrition sites by making them aware of the analysis that we're doing for folks continually and during the annual election period at a particular location can make a big difference as to how you're perceived and the beginning of a relationship with folks that run these programs as well. So you can leverage that relationship for opportunities throughout the year. It also gives us an opportunity to deal with folks that are meeting in a more of a social type of setting through senior centers. These are folks that have been hit up by a whole bunch of folks offering services, offering different things that can come into play. You go in with different flyers that announce when you're going to be in a particular location, dates and times, and say, hey, I'm offering this service. I want to make your folks aware of the opportunity they have to review their current coverage versus the new plans coming out for 2023. And that may well be your door opener for presentations at these locations as well. And the same thing comes into play with retirement communities where people live, be it folks that are paying a higher rent or for those that are in a low income housing situation. In many cases, specific special election periods, well, they'll apply for these folks on a year-round basis as well. So I think at this point in time, you're probably aware of the fact that we're looking at this not just as setting up activity for the fall, in a manner of speaking, for the upcoming AEP, but we're looking at this prep time as also an opportunity for us to open doors for presentations now. If you're looking at a person who may qualify for low income housing, they may well qualify for the extra help, for the low income subsidy on the cost of their medications. They may well qualify for a Medicare savings program that can help them qualify for special needs plans within the Medicare Advantage arena. So it gives us an opportunity now and through AEP as well. When we look at providers, if you're working hand in hand with a specific carrier through one of their locations, or if it's a carrier that's part of perhaps your Walmart campaign or something that you're working with on your own through a DIY project, well, let's identify the providers in that area as well. Starting with primary care physicians, there's a number of ways that we can determine where these folks are that are actually delivering the care to the folks that we're enrolling in different Medicare programs. It gives us then the opportunity to visit with these locations and let them know the services that you're offering to the population in the community and alleviate that pressure from that provider. It also gives you an opportunity to begin that relationship with that provider on a year-round basis. Who's some of the first folks that realize that people are aging in to Medicare coverage or are new to the area with Medicare coverage? As they are new patients for a provider, it's also a new opportunity for coverages and a way to make certain that you're the one that's there to handle that opportunity. Then, of course, there are doctors that aren't part of a network. They still need your help too, because they want to maintain their patient base. There are some things that you can do to help them and still tie that patient to that provider. So we want to be able to deliver upon that premise based on the fact that we're looking at their medication coverage and their base medical may be more of a med sup opportunity than Medicare Advantage because of the network that's involved in the Medicare Advantage plans. It also gives us an opportunity to visit with other providers such as dentists. There are carriers out there that have full-blown marketing campaigns for dentists, particularly within their D-SNP programs, their dual special needs plans. This is a huge opportunity to go in and offer your services to help them as part of a network on a Medicare Advantage plan or as an independent with the dental programs, standalone dental programs that you offer to folks that are part of your marketing scope. There are also other locations that we can visit and leave flyers or business cards that are places where the Medicare population congregates. The favorite restaurants, the coffee shops, the beauty parlors, the bingo halls. Having those flyers available and distributing them at these locations, obviously with permission, but also in many circumstances, it may be as simple as a business card that speaks to who you are, how to contact you, and the general offerings that you make to the population. A great way to market right into the community with folks that, hey, I don't take any prescriptions. I rarely go to the doctor. I need the coverages, but I sure do eat out. I get my hair done. I play bingo. I have regular meetings at the coffee shop with the gang, so to speak. A great way to get your name out into the community that way as well. This is an older slide, of course, but it's amazing how many locations within the restaurant community offer senior discounts. And this may well be a source of information for you to distribute your information once again as well, particularly with the financial stress that many of these locations have had because of the pandemic and the opening and closing and opening of their locations. They need the business too. They may well be much more receptive to your overtures of help than they have been in the past. Great way to visit or revisit different locations in this scenario. It's important with all these locations that you're visiting, all of this marketing activity you're doing in preparation, not just for the annual election period, but hey, wink, wink, nudge, nudge, for marketing opportunities now. You are keeping a journal, you're tracking your activity, and you are laying out, here's where I went, this is the person I spoke to, here's the response. You then take that and go back to your market venue location, your retail store, your pharmacy, and you let them know what you're doing to drive business to that location and how your efforts are going to help them as well. So it's much more of a symbiotic relationship rather than you sitting at a cubicle waiting for someone to come by and hoping that the pharmacy staff is going to refer people to you. At least let them know that you're there. Well, when you do this and you're providing them a sample of what you're distributing, you let them know, here's where I've been. This is the response that I have. It's amazing the difference that this can make in deepening the relationship you have with the pharmacist in that location, the different staff that's there, and how that can make a huge difference as to whether or not these people are going to drive traffic to you at foot traffic that may be otherwise avoiding you in that location. In order to do so, we've got to be prepped and ready to go. So that means we have to be trained. We have to certify. And we obviously have to certify with any of the carriers that we're offering in these different locations. This may well go beyond just product certification, fraud, waste, and abuse, all the other lovely things that we have to go through in the certification process. But if we look at that as a learning opportunity and it differentiates one carrier from another, as it does, yeah, there's a whole lot of similar shades of lipstick on that pig, but there are key differences, and these trainings can help us identify what they are and give us a better understanding of how some of these carriers are going to treat our people. Are we aware of the tools that those carriers have to help us in the enrollment process, in the marketing component, in order to drive people to your book of business? And do they have any optional trainings that help you with the retail marketing as well? What kind of support do they have there? What are they specifically doing to help you? Walmart campaign's got a ton of different material out there that can help you market. And in that situation, you can only use their materials. You can't even have your own logo on your shirt for your agency when you are staffing one of those locations. A little different animal if you're going into a relationship or into a situation that's sponsored by a particular carrier because they want you labeled with their stuff. So we want to make certain that we're doing what we need to follow direction, but also garner support because of those actions. We want to be very, very aware of the support programs, the entitlement programs, whatever you want to call them, that can make a big difference as to their cost of coverage. How low income subsidy extra help affects the cost of their medications, regardless of the base medical program that they're in, the coverages that they have, how it layers over that. Same thing with the Medicare savings programs and being aware of those opportunities because one, we want to fully discuss their coverages, but two, that qualification, well, we still have the third quarter set for that stuff that we can take advantage of now. We also want to be made aware of if you're working with our organization or one of our platform partners about how Medicare Center and the quote engines and the different tools within that tool can help you. A little bit of investment into how that program works now, boy, it'll save you countless times, countless hours moving forward in sales situations. We also want to be very aware of how we deal with the government resources here as well. Been some challenges with the Medicare.gov plan finder over the last few years. It's changed a great deal as they changed vendors. However, it is a source of truth for many folks on Medicare. We want to be able to explain the programs that are on there, how we can differentiate between plan types. We've got actually a recording of a webinar that directly addresses that. The recordings about Medicare Center and low income subsidy and Medicare savings plans, a number of these different pieces. And that also includes a Medicare 101 review because we need a firm grasp of those benefits as well. And it gives us the opportunity to make folks aware of Medicare is not the end all be all for coverages. There are many things there that people assume are covered by Medicare that we know are not. So there's another webinar recorded that speaks to what Medicare covers and what it doesn't. It gives you an opportunity to make certain that you are properly communicating what Medicare covers and how you can deliver upon solutions for the shortfalls. We also have a program on how to work referrals, how to ask for them, how to take one lead and make it go forth and multiply in a manner of speaking. This includes an opportunity to do so in a prospecting and a sales situation, but also as a review to our current book of business. So all these different things we have under our belt to be prepared for influencing the success of the investment of our time in this initiative. You got to remember, we don't put all our eggs in one basket. And so we're going to look for support from the multitude that we've spoken of already, but also from us here at Premier as you work with us. I spoke to the fact that in certain retail settings, you're going to want multiple carriers. How can you do that as efficiently and as effectively as possible? Well, you're going to do it like everything else nowadays. You're going to be doing it electronically. You can set up an agent profile within SureLC, Insurance Bay, whatever you want to call that particular program. It's a great way for you to store your detail in there and then contract electronically with multiple carriers. There are certain carriers that don't participate in this program, and there are certain carriers that at particular times of the year, we're going to want to use their systems directly to speed up the process and make certain that these can come into play for you. But it's all part of that wonderful electronic experience, and it is a great start for you to add to your portfolio of products, particularly really helpful when adding ancillary programs. We do offer discounted E&O to qualified agents. What makes you a qualified agent? You got a contract with us. How do we make certain that this E&O will cover us the way we need to? Have it cover us? Well, keep in mind, this is a program you own. It's not like being added to a blanket E&O policy for one program or another and then have to scramble for a way to cover this requirement that just about every insurance company requires of you now to contract. It does have a wide range of protection on products, is reasonably priced, and keep in mind, once again, you own this program. And it will cover you for carriers regardless of whom you contract through. We do also offer discounted continuing education courses through our relationship with WebCE to make certain that we keep your license in play as well. And you have a means of adding to your own benefit portfolio, your own benefit protection package by utilizing a modified guarantee issue policy for disability income in which you're paid a commission. Total aside, but it's a way for you to protect your own ability to earn as well. Much as where today's presentation is being recorded and it will be made available on our website and on our YouTube channel, past presentations are already there. So if you're looking for hints and tips on how to approach providers, boom, there's a recording, more than one, in there on that topic. How do you work with churches? How do you work with a faith-based community? Boom, there are recordings on that as well. There are also recordings for different carriers, different concepts that are on there. A very extensive library of programs available to you 24/7. A great way to get brought up to snuff with the different opportunities that are there. I cannot overemphasize the value of Medicare Center. It is a program made available to contracted agents without cost. Yeah, I'm an old MA agent and have a hard time with the word free, no matter what J.J. Walker says on television. But this is a program with a universal login to access multiple resources, including multiple quoting engines and other tools, includes the engines that are powered by Connexure, Sunfire, and CSG. It gives us an opportunity to collect the scope of appointment through multiple methods, store it for that 10-year period, whether we sign them up or not, and do so compliantly. It then gives us the opportunity to provide side-by-side plan comparisons to the population we're addressing in a compliant fashion based on their specific needs. It also comes with a CRM for your use with your prospects and clients. You can download information in there. We don't access it. We don't mine it. It is there for you to use. It gives you then that opportunity to do that year-over-year review. Maybe as simple as, hey, last year's program we had, these are some of the medications that you're on. Are there changes? Because there are changes in the programs. We want to make certain that you are still in the plan that can work to your greatest advantage. And then, of course, there are other resources in there, such as sales scripts and other pieces to help make you successful. This is a tool that will soon be rolling out the much vaunted and needed presentation recording capability. That will be made available within Medicare Center very soon. And there is also a lead center coming into that program as well. So some big advancements coming, multiple improvements to the already an incredibly strong program that can help you now and year round. And that includes an opportunity to fill the gaps. There are certain markets where a certain carrier may dominate that market for one reason or another. You're not going to move that person off the plan at gunpoint. Bad reference right now. Pardon me. Any type of undue stress. This gives you the opportunity then that if they're on a Medicare Advantage plan, how can we use a hospital indemnity program to plug that hole in the coverage? Those daily or per stay co-payments that are part of Medicare Advantage programs. A great way for you to make certain that, hey, if we're not getting the sale for the product we've gone in there for initially, they just wanted to be comfortable with the fact they're still in the best plan for them. It gives us a sales opportunity and a track to follow. And that's important because the more policies we have in the house, the higher our retention, the larger our persistency. And they don't have to be programs with the same company. They just have to be programs with the same agent. And that's you. This gives us that opportunity to use that tool to drive up our retention as well. We do also have a page on our website that lists all the carrier incentives. So you can go to one location, and while there aren't opportunities for additional compensation for Medicare Advantage and prescription drug programs, because the max comp is set by the government, that does not apply to Medicare supplements and other ancillary programs or other programs across the board. And these incentives are a true indication of your total compensation for those programs, and they may well help you qualify for trips if made available by that carrier, and will help you qualify for premier incentive programs as well. We do provide different lead sources through custom call lists made available to you for products that allow for that in areas that allow for that. We spoke of the different campaigns we have to reach into the community for the influencers specifically in that particular market. Different carriers will generate prospects for you. This is generally a quid pro quo situation where they're scratching your back, you're scratching theirs. That relationship, once again, with that MA, Medicare Advantage area agency manager, well, they're the ones that pulled the strings on those prospects and those leads. So it's great to have that relationship and be part of that lead flow if available. We do offer internet leads through social media as well, direct mail support, a T65 locator, and once again, that referral program that I visited upon a bit ago. That direct mail support is based on production, 2 different ways of qualifying, through health programs and through final expense, but this gives you the opportunity to utilize this resource, which, hey, Mark Twain's quote of the reports of my death are greatly exaggerated. Direct mail still works. There's tweaks that we need to do. We need to make certain we're working with reputable vendors in order to do so. But this gives us the opportunity to do so consistently because it's driving down that cost. It is through vetted preferred lead vendors. You have to go through them for this particular support. But these different organizations have systems that can deliver those leads to you as soon as they become available. And we're vetting the correspondence they send out to make certain that we all remain in compliance. There are also different campaigns for you to kind of plug holes. One of our partners helps us with a direct mail response program that have never been touched. Costs vary per type of program. It will vary by time of year, by location. It's all supply and demand. These are as high as I've seen these processes or prices ever. But it's a great way to fill holes or to add to a campaign where you're not looking to direct the entire mail campaign yourself. Those internet leads are through Facebook. There's a program for final expense and Medicare. Keep in mind, the internet leads are a microwave situation. Food's hot and ready now. And if that's the case, you need to be prepared to respond hot and ready now as well. So those are available to you as well. That T65 locator is another free resource for contracted agents. You download it on your smartphone or on your laptop, register for it. Your contracting status is verified. It then allows you access to a ton of information that's out there that actually plots out where these people are. It's a great way for us to make certain that we can fill gaps in our schedule in a particular area with a door knocking situation for programs that allow that, dental, final expense, whatever it happens to be. A great tool for you to use and particularly helpful for Medicare supplement opportunities as well. It's important for us to realize that we have a great resource in our database, and that's our current book of business. Asking them for referrals is not only a way of soliciting additional prospects, it's another way of initiating a conversation with folks we've already sold. A great way to drive up your persistency, a great way to cross-sell as well. And we do so because we want the opportunity to work with you. We want your business. We want to be referable to your agent friends as well. And so we ask you to take these hints and tips that we're providing as to a market venue, a retail situation, and make them part of your personal marketing plan. You do it now. As Shawn Wayne said in the 50th anniversary, well, he said it through filming originally, of the movie The Cowboys, slap a piece of bacon in that biscuit, saddle up, and let's ride because we're burning daylight. You put this in play now. It's a great way to increase business in the fall, but it's a great way to uncover opportunities now. If you're anything like me, I'm in Texas in 104-degree heat today. My air conditioner's out, so it's 88 degrees in my house. I work out of my house. I need to pay those bills now too. We want to make certain that this can drive you business not only for your retail opportunity in the fall, but also now. So all that said and done, I'm going to check really quickly to see if there are any questions that I have left uncovered. Doesn't appear to be. So at this point in time, it's down to thank you. For those of you that have done business with us here at Premier in the past, I thank you for that business. We look forward to deepening that relationship and expanding the scope of the product that you have available. For those of you that are considering doing business with us, I thank you for that opportunity. We look forward to serving you and the needs of you and your prospecting client base. But I also really want to make certain that I thank you for the time that you've invested with me here today. It's your most precious resource. I realize that. I hope you feel you have received value out of today's presentation. I tend to talk a lot, I tend to talk fast, but I thank you for taking the time to visit with us today on a program that we genuinely feel can drive you additional business. So all that said and done, until we're able to visit again, I wish you good selling. Thanks so very much. We'll talk soon.